17 visible signs of heart disease. That you can identify right now. Have you ever noticed that the body speaks before the disease appears? The truth is that many heart problems begin silently, but leave clear clues on the skin, hands, feet, and even on the face. Signs that anyone can identify at home without equipment. What you are about to learn is not meant to scare you, but to get your attention. Because the earlier we detect the risk, the greater the chance of avoiding something more serious. 1. Cold and bluish extremities, cyanosis, when the body calls for help. If your fingers, lips, or the tip of your nose turn bluish or purplish, especially at rest or in the cold, this may be a sign that blood is not reaching the tissues with enough oxygen. The bluish color appears when circulation is compromised, and the heart, for any reason, cannot send blood efficiently. It is not always a heart attack coming. It may be advanced heart failure, severe valve problems, or even congenital diseases that only manifest in adulthood. It is one of the clearest signs that oxygenation has dropped, and the sooner you investigate, the better. Very dilated neck veins. The pressure that rises and no one notices. People with decompensated heart failure often have visibly full, pulsating, or elevated neck veins. When the heart loses strength to pump, blood begins to accumulate in the venous system. And the first place where this appears is in the jugular vein. This is one of the most reliable clinical signs. It does not hurt, it does not itch, and it does not attract attention in the mirror. But it says a lot about what is happening inside the chest. If you notice swelling in the neck veins when lying down, or lowering your chin to your chest, this deserves evaluation. Livedo reticularis, the purplish net that reveals poor circulation. You may have already noticed a net-like pattern, purplish or bluish, on the skin of your legs or arms. This pattern is called livedo reticularis. It appears when small arteries constrict or become blocked, leaving areas of skin without adequate circulation. It is not always serious. Cold can cause this pattern in healthy people, but it should be concerning when. It does not disappear when the skin is warmed. It causes pain. It comes with sores. It appears suddenly for no apparent reason. In severe cases, it may indicate autoimmune disorders or microemboli coming from the arteries, and these microemboli may originate in the heart. 4. Visible nail pulsation, Quincke's sign, a detail almost no one notices. When the aortic valve is very weakened and allows blood to leak backward, blood pressure fluctuates dramatically. This fluctuation causes a curious and very visible effect. The nails seem to pulse as if they were breathing. If you gently press the tip of the nail and observe the color alternating quickly between pale and pink, this may be Quincke's sign. It is rare, but extremely useful to recognize significant aortic regurgitation. A problem that, if untreated, leads to heart enlargement and heart failure. 5. Pitting edema, the swelling that keeps the mark of your finger. The classic swelling that sinks usually appears in the legs and ankles. Press the skin over the shin bone for a few seconds. If the finger mark stays for a while, this is pitting edema. This sign appears when the heart cannot pump blood efficiently, causing fluid to leak from the vessels into the tissues. However, it is important to differentiate. Edema from heart failure tends to worsen at the end of the day, especially if there is shortness of breath. Edema from other causes, pregnancy, prolonged inactivity, use of certain medications. Still, any persistent swelling deserves attention, especially if it comes with fatigue when walking or sudden weight gain. 6. Shortness of breath when lying down, orthopnea. The breathing that exposes lung overload. Sleeping should be a moment of rest. But for those who are accumulating fluid in the lungs, lying down worsens the feeling of suffocation. The person begins sleeping with several pillows, or even in a recliner, because they feel short of breath when lying down. Orthopnea is one of the strongest signs of left-sided heart failure. This happens because, when lying down, the fluid that was in the legs returns to the chest, overloading the lungs. It is not just uncomfortable, it is a clear warning that the heart is struggling. 7. Irregular pulse. When the rhythm is lost and the risk increases, Atrial fibrillation is one of the most common arrhythmias, and it often goes unnoticed. The pulse becomes completely unpredictable, irregular, without any pattern. Instead of beating rhythmically, the heart sends chaotic impulses. The greatest danger is not the arrhythmia itself, but what it causes. Blood stops circulating properly inside the heart chambers, forming clots that can travel to the brain and cause a stroke. The good news: just feeling your pulse for a few seconds can give you a clue. If it is irregular, even intermittently, it needs medical evaluation. 8. Clubbing. The fingertips tell a story. Clubbing is a thickening and rounding of the fingertips, making the nails more curved and shiny. It develops slowly, over months or years, and may indicate chronic lack of oxygen. When the cause is cardiac, it is usually related to malformations present since birth, diseases that drastically reduce oxygenated blood flow. If you bring the nails of both index fingers together and the small triangle of light does not appear, this is a typical sign. 9. Raccoon eyes. Easy bruising that reveals deep fragility. Purple bruises around the eyes, without significant trauma, may indicate fragility of the small blood vessels in the skin. This happens in conditions such as amyloidosis, which can directly affect the heart muscle, making it stiff and unable to pump properly. It is one of the most unexpected signs, and for that reason, it is often ignored. But when it appears, it deserves careful investigation, especially if it comes with extreme fatigue, leg swelling, or palpitations. 10. Diagonal crease on the earlobe, Frank's sign, a mark linked to arterial aging. A deep crease cutting across the earlobe diagonally may seem like just an aesthetic feature, but studies suggest that this crease is associated with early aging of blood vessels. The hypothesis is simple. If the small arteries in the earlobe already show loss of elasticity, this may also be happening in the coronary arteries. It is not a definitive sign, and it becomes more common with age. But when it appears prominently or bilaterally in young people, it is worth discussing with a cardiologist, especially if there is a family history of coronary artery disease. 11. Xanthelasma, yellowish plaques that reveal excess cholesterol. Yellowish, flat patches near the corners of the eyes may indicate cholesterol buildup under the skin. This deposit, called xanthelasma, is an external reflection of what may be happening silently inside the arteries. Even people with seemingly normal test results can show this sign. This happens because some types of oxidized cholesterol deposit in tissues even before reaching critical levels in the blood. If you notice these plaques, request a full lipid evaluation and investigate any family history of hypercholesterolemia. 12. Premature corneal arcus, the grayish ring that may appear early. A whitish or grayish ring around the iris is common after age 60, but when it appears before 45, it deserves attention. This arc indicates fat and cholesterol deposits on the edges of the cornea and may be an early marker of metabolic changes. When associated with a family history of high cholesterol, obesity, or hypertension, it becomes an even more relevant sign. It is a simple but powerful clue observed in a place where no one expects to find evidence of heart disease. The eyes. 13. Waxy papules, cutaneous amyloidosis, when the skin reflects deep cardiac damage. Small waxy, firm, and shiny lesions, especially around the eyes, neck, and ears, may indicate the buildup of abnormal proteins in the body, known as amyloidosis. In many cases, the heart is also affected, becoming stiff and thick, which compromises its pumping capacity. Cardiac amyloidosis is often underdiagnosed. Therefore, noticing these skin changes may be essential to prompt a more complete investigation. Patients with these signs may present intense fatigue, leg swelling, and palpitations. Enlarged tongue with teeth marks, macroglossia, a silent warning. A visibly enlarged tongue with lateral marks left by the teeth is another classic sign of the deposition of abnormal proteins in tissues. This enlargement can make speech difficult, cause snoring, sleep apnea, and in some cases, indicate systemic amyloidosis, when macroglossia is associated with unexplained fatigue, weight loss, or leg swelling. Cardiac investigation becomes even more urgent. It is a simple sign, seen in the mirror, but deeply revealing. 15. Osler and Janeway lesions, small spots that may indicate heart infection. Painful nodules on the fingertips, Osler nodes, or painless reddish spots on the palms and soles, Janeway lesions, may indicate infective endocarditis, an infection of the heart valves. These lesions occur when infectious fragments travel through the bloodstream and deposit in the skin. The condition is serious and can cause persistent fever, chills, weight loss, and intense fatigue. They are subtle signs, but should never be ignored. 16. Linear hemorrhages on the nails. Small splinters that show microthrombi thin, dark streaks under the nails, resembling splinters, are called splinter hemorrhages. They can be caused by simple trauma, such as hitting the nail, but are also present in conditions involving capillary fragility, autoimmune diseases, and heart infections such as endocarditis. The most important thing is to observe the context. When they appear on several nails and are accompanied by fever, fatigue, or joint pain, they become an even more relevant sign. 17. Audible heart murmur. When the sound of breathing reveals a heart problem, although many heart murmurs require a stethoscope to be detected, more intense murmurs can sometimes be perceived by the patient, especially during deep breathing. These sounds occur when there is valve narrowing, turbulent blood flow, or significant structural defects. Intense murmurs are often linked to conditions such as aortic stenosis, mitral regurgitation, or congenital heart disease. Any auditory change perceived as an extra sound in the chest deserves investigation. None of these signs on their own provide a definitive diagnosis, but together they form an important map, a set of clues that allows early action, risk reduction, and prevention of greater harm. The body warns us. The question is, are we paying attention? If any part of this video made you look at your own body with more attention, then it has already been worthwhile. But don't stop here. Information only makes a difference when you act. So do the following. Observe these signs carefully. Talk to your doctor if something catches your attention. And continue learning about what your body is trying to say. And if you want more videos like this, direct, clear, and evidence-based, like this video, subscribe to the channel and share it with someone who may benefit from this information. It may be exactly the warning that person needed. Your health begins with knowledge.